The fluorescent lights in Seattle Grace's trauma bay hummed with that constant sterile frequency that made everything feel temporary. 3:47 in the morning, and the night shift moved through its rhythm like a tired heartbeat, slow and predictable. Dr. Maya Chen wiped down the intubation cart for the third time that shift, her movements precise, economical. 28 years old, surgical resident, second year. The kind of invisible that comes from being competent enough to not screw up, but not loud enough to be noticed. Her hands moved across the metal surface in careful strokes, removing nothing because there was nothing to remove. But the motion kept her busy, kept her beneath the radar, kept her exactly where she needed to be, unnoticed. Dr. Marcus Webb stood 15 feet away, scrolling through his phone, trauma gown hanging open over expensive scrubs. Attending surgeon, 42 years old, with the kind of confidence that came from never being questioned. He didn't look up when he spoke. Chen, restock the crash cart. Someone left it a disaster. She was already moving toward it before he finished. And check the suture inventory in Bay 3. Already done. He glanced up, annoyed that she had anticipated him, annoyed that she had moved before being told. His mouth tightened. Then find something useful to do. Across the room. 2 other residents were discussing a complex bowel resection like they had personally invented the technique. Both male, both louder, both exactly the kind of doctor Webb wanted to see in the mirror. He gravitated toward them, laughing at something one said, his phone finally going into his pocket. Maya's hands moved through the supply check with automatic efficiency. 14-gauge IVs, placed in order of size. Laryngoscope blades, cleaned and aligned. Chest tube kit. Inventoried and positioned at exactly 45 degrees for fastest access. She worked like she was alone, which, functionally, she was. Near the nurse's station, 2 voices drifted over the low hum of monitors. Did you see her actually try to suggest an approach earlier? Stephanie, one of the senior nurses, wasn't bothering to whisper. To Dr. Webb, like she's suddenly attending. She's just a resident, another voice responded, dismissive and easy. Barely. Maya's fingers paused, just for half a second, on a 10-blade scalpel. The weight of it, the balance, the cold surgical steel that fit in her palm like it had been made for her grip alone. She turned it once, felt the edge without testing it, and set it down gently, precisely, exactly where it needed to be. Then she moved to the next task. At 3:12, the radio crackled to life. Incoming trauma, ETA 4 minutes. MVA, single vehicle rollover, driver unrestrained, GCS 7. BP dropping, 70/40. The teen assembled with practiced chaos, residents shouting updates they barely understood, nurses prepping lines with the efficiency of people who had done this 1,000 times. Webb sliding into his trauma gown with the ease of someone who had never doubted his place in the room. Maya stepped back, positioned herself near the supply cabinet, hands loose at her sides. Waiting. The doors slammed open. The patient rolled in seizing, his body rigid, jaw clenched, eyes rolled back. Blood pressure continued to drop. Oxygen saturation at 82 and falling. Secure the airway, Webb barked, stepping to the head of the bed. One of the second-year residents grabbed the laryngoscope, his hands shaking as he tried to visualize the vocal cords. Once, twice, the blade slipped. The patient gagged. Oxygen saturation dropped to 79. Come on, Webb muttered, leaning over his shoulder. 76. I can't see the cords, they're swollen. Move. Webb shoved him aside, took the scope himself, adjusted the angle. 74. Cords are anterior. I can't. Crike kit, Maya said, already pulling it from the cabinet behind her. Webb shot her a look, sharp and fast. I didn't ask for. Sats are 72, he's going to arrest. Her voice wasn't loud, it didn't need to be. Webb hesitated, ego and reality colliding in real time. His hands still holding the laryngoscope, like it might suddenly cooperate. 70. Maya placed the cricothyrotomy kit on the sterile field beside him, her hands completely still. Webb's jaw tightened. Then he grabbed it, made the incision with more force than necessary, passed the tube, and the monitor climbed. 74, 81, 87, 93. The room exhaled. Webb straightened, pulled off his gloves with a snap, and tossed them into the trash. He glanced at Maya, his expression unreadable. Good call, Chen. He said it like a favor, like permission granted after the fact. She nodded once, stepped back into the shadows, and returned to restocking the cart. Stephanie watched her from across the room, frowning slightly, like she had just seen something that didn't fit, but couldn't quite name it. Maya's hands moved in perfect rhythm, placing supplies in exact order, her face calm, her breathing even. She didn't meet anyone's eyes. On her wrist, barely visible beneath her scrub sleeve, was a thin paracord bracelet, faded green and black, frayed at the edges, tied in a bowline knot that didn't belong in a civilian hospital. She pulled her sleeve down, kept working. Invisible again. Maya stood in the supply closet at 4:18 in the morning, counting chest tubes under the flicker of a dying fluorescent bulb. The smell hit her first. Sterile plastic. Iodine. That faint metallic tang of dried blood on packaging someone hadn't fully cleaned. Her hands stopped moving. The air in Kandahar smelled like dust and copper. Every surgery smelled like death delayed, like bodies held together by will and suture, and nothing else. The supply tent had no air conditioning, just heat that made the instruments burn to touch, and blood that dried brown on your gloves before you could even finish the case. She blinked. The closet came back into focus. She forced her hands to continue. 12 28 French tubes, 8 32s, 4 pediatric sizes she hoped they would never need. Her breathing stayed even, controlled, the way it always did. In the field hospital, you didn't get the luxury of hesitation. You didn't get clean bays and pre-labeled kits. You got a soldier bleeding out on a stretcher made of plywood, and you had 90 seconds to decide if he lived or if you moved on to the next one who might. Maya closed the cabinet. Her reflection stared back from the glass door. Dark eyes, hair pulled tight, a face that had learned not to show anything. She didn't recognize that woman anymore. Behind her, the door opened. Chen? She turned. Dr. Patel stood in the doorway, ER attending, 53 years old, one of the few who didn't treat residents like disposable equipment. He held a tablet in one hand, reading glasses pushed up on his head. You okay? Fine. He studied her for a second too long, his eyes moving across her face like he was reading vitals. You move different than the other residents. Her pulse spiked, but her face didn't change. Different how? Efficient, like you've done this somewhere else. He paused, weighing his words. Somewhere that didn't have time for mistakes. She met his eyes. I went to a good medical school. I'm sure you did. He didn't believe her, but he also didn't push. He left, and Maya stood alone in the fluorescent hum, staring at her hands, steady, scarred along the right thumb from a field suture she had done on herself after a mortar strike took out the tent's south wall. The needle had been dull. The light had been a headlamp. She had sewn herself closed in 4 minutes and gone back to work. She flexed her fingers. Captain Maya Chen, 274th Forward Surgical Team, United States Army. 3 tours, 14 months in Kandahar, 2 in Mosul, 43 soldiers saved, 11 lost. She knew their names. She knew their faces. She knew exactly how each of them had died. She pulled her sleeve down over the paracord bracelet, the one she had tied the day she left, the one she told herself she would cut off when she finally stopped seeing their faces every time she closed her eyes. It was still there. The closet smelled like iodine again. Just iodine. She walked back into the trauma bay, where Webb was talking to the 2 residents near the coffee station, his voice low and approving. They laughed at something he said. He clapped one on the shoulder. Maya moved past them toward the board, checking the overnight paces, the discharge list, the incoming schedule. Patel was at the desk, still watching her. She felt it without looking. At 4:40, a nurse called out from Bay 2. Doctor, I need eyes on this. Maya walked over. The patient from earlier, the one Webb had cricked, was awake now, groggy and confused, his hand reaching for the tube in his throat. Hey, Maya said quietly, stepping into his line of sight. Don't touch that. You're intubated. You were in an accident. His eyes focused on her, wild for a moment. Then settling, she moved with calm precision, checking his pupils, his oxygen levels, his IV line. Her hands worked without hesitation, every motion clean and deliberate. The nurse, a younger woman named Lauren, watched her closely. You're good at this. Maya didn't respond. I mean it, you're really good. Lauren hesitated. Where did you train? Here. No, I mean before here. Maya's hands paused, just for a fraction of a second, then continued adjusting the IV drip. I did my undergrad on the East Coast. It wasn't a lie. It just wasn't the whole truth. Lauren nodded slowly, but her expression said she didn't quite buy it. Maya finished the check, updated the chart, and stepped back into the hall. Patel was still there, still watching. "Captain," he said quietly. Maya froze. He didn't say it again, didn't clarify. Just looked at her like he had confirmed something he had suspected for a while. Then he walked away. Maya stood alone in the middle of the trauma bay, her heart pounding in her chest, her hands perfectly still at her sides. She looked down at the paracord bracelet. Faded, frayed, still tied. She pulled her sleeve down and went back to work. The call came at 6:47 in the morning, right as the night shift was preparing to hand off to day team. Incoming level 1 trauma. GSW to the chest, tension pneumothorax, 3rd-degree burns to the right arm. ETA, 2 minutes. Webb looked up from his coffee, his face shifting into the focused mask he wore for serious cases. GSW? Gang-related? Negative. The dispatcher's voice crackled back. Veteran. PTSD episode. Self-inflicted. Maya's pen stopped mid-note. The rig doors slammed open. The man on the stretcher was seizing, his chest pulling inward with paradoxical movement, ribs collapsing on one side while the other expanded. Right lung collapsed, left barely functioning. Blood pressure 70/40 and dropping fast. "Get me a chest tube kit." Webb was already gowning, his movements fast but controlled. Maya was faster. She had the kit open, 32 French tube prepped, betadine swabbed across the insertion site before Webb finished tying his gown. Her hands moved with a speed that didn't match her usual quiet presence, like muscle memory from somewhere else had taken over. "Good, Chen, assist." He made the incision between the 4th and 5th ribs, clean entry, but too shallow, too hesitant. The tube wouldn't advance. The patient's oxygen saturation dropped to 68. "He's crashing." One of the nurses, voice rising with the kind of panic that came from knowing what 68 meant. Webb pushed the tube again. It caught on something. Wouldn't pass. "There's adhesion or scar tissue I can't." "He's had a thoracotomy before," Maya said quietly. "Left lateral, 4th intercostal space. Probably IED blast, judging by the burn pattern on his shoulder." Webb stared at her. "How do you angle it posterior, 30 degrees, blunt dissection first or you'll perforate." Her voice was calm, clinical, but something in it made Webb pause. Something that sounded less like a suggestion and more like an order. He hesitated, then adjusted his angle, used the clamp to dissect bluntly through the adhesions. The tube slid in. Air hissed out, loud and sharp, the sound of a lung reinflating. The patient's chest expanded. Oxygen saturation climbed. 74, 81, 89. The room breathed again. Webb pulled back, stripped his gloves, and looked at the patient's chart for the first time. His eyes scanned the page, then stopped. "You're right, thoracotomy, 2019. Helmand Province." He looked up at her. "How did you know that?" Maya didn't respond immediately. She was already cleaning the field, hands steady, eyes distant, moving through the motions like she had done this 1,000 times under worse conditions. "Chart said he was a veteran," she said finally. "Burns and GSW suggested PTSD crisis. Scar tissue is common in blast survivors who've had prior chest surgery." "That's not in the chart. It's in the presentation." Webb frowned, his eyes narrowing, but the patient groaned and the moment passed. He turned back to the stabilization, calling out orders for imaging and blood work. Maya stepped back, stripped her gloves, and walked toward the scrub sink. Patel was standing near the doorway, watching. He didn't say anything, but his expression had shifted. Not suspicious anymore. Certain. She scrubbed. Her hands in silence, the water running cold over her knuckles, and kept her eyes down. Behind her, the patient was being wheeled toward imaging. Stable now, breathing on his own with supplemental oxygen. The burn on his arm was severe but manageable. The GSW had missed the heart by inches. He would live. Webb was talking to one of the residents, explaining the procedure, his voice confident and educational, like he had known exactly what to do the entire time. Maya dried her hands and walked toward the locker room. Stephanie was standing near the hallway, arms crossed, watching her pass. "That was impressive," she said, her tone halfway between suspicion and respect. Maya didn't stop walking. Just did what needed to be done. You knew things you shouldn't have known. Maya paused, her hand on the door. She looked back, her face unreadable. I read the chart. No, Stephanie said slowly. You didn't. Maya pushed through the door and let it close behind her. Inside the locker room, she stood in front of her locker, hands resting on the cold metal, breathing slowly. Her reflection stared back from the narrow mirror inside the door. She looked tired. She always looked tired. On the bench beside her locker, her phone buzzed. A message from an unknown number. You still got it, Captain. She stared at the screen, deleted the message, put the phone away. She pulled her sleeve up, looked at the paracord bracelet, and wondered how much longer she could keep pretending she was someone else. Then she pulled the sleeve back down, closed the locker, and went back to work. The patient woke up at 11:23 in the morning. Maya was checking his vitals when his eyes opened, wild and disoriented, scanning the room like he was looking for threats. His hand went to his chest, feeling for the tube, for the wound, for whatever had brought him here. You're safe, she said quietly, stepping into his line of sight. Seattle Grace Hospital, you're okay. His breathing slowed, but his eyes stayed sharp, alert in a way that didn't match someone who had just coded. He focused on her face, then his gaze dropped lower, to her hands, to the paracord bracelet barely visible beneath her sleeve. His expression shifted. You sove? Maya hesitated, her hand instinctively pulling back. I'm a doctor. That's not what I asked. Silence hung between them, heavy and specific. He looked at her the way soldiers looked at each other, seeing past the uniform or the lack of one, past the role, straight into the truth underneath. What unit? I don't... Captain. The word came from the doorway. Maya froze. A man stood there, mid-40s, graying at the temples, wearing a faded army jacket over civilian clothes. He was staring at her, like he had just seen a ghost walk out of a memory he thought he'd buried. Captain Chen? The room went silent. Webb, who had been reviewing labs at the desk, looked up. Excuse me? Who are you? The man didn't answer. He stepped forward, eyes locked on Maya, his face a mixture of disbelief and recognition. 274th Forward Surgical Team, Kandahar, 2017. Maya's face went pale, her hands frozen at her sides. I'm sorry, she said quietly, her voice tight. You have me confused with someone else. No, his voice cracked. I don't. Webb stood, his posture shifting into something protective and confused. Sir, you need to leave. This is a restricted. You saved my life. The man's eyes were wet now, his voice barely holding together. Convoy hit an IED outside Kandahar. I had a sucking chest wound and a severed femoral artery. You operated in the back of a moving Humvee for 40 minutes while we got shelled. The room was staring now. Webb, Patel, who had appeared near the doorway, Stephanie, 2 other residents who had been passing through. Maya's hands were shaking. I don't know what you're talking about, she said, but her voice had no strength behind it. You told me to stay awake. His voice broke. You said, you're going to meet your daughter, Sergeant. Stay with me. You wouldn't let me close my eyes. He pulled out his phone, hands trembling, and turned the screen toward her. A photo of a little girl, maybe 7 years old, smiling in front of a birthday cake. Her name is Emma, he whispered. She's 7 now, because of you. Silence. Maya stared at the photo, and something inside her cracked. Webb stepped closer, his face a mixture of confusion and growing realization. Chen, what is he talking about? I'm just a resident, Maya said. Voice barely audible, like saying it out loud would make it true. Numb. The man's voice was firm now, certain. You're Captain Maya Chen. You were the best combat surgeon in the entire theater. Everyone knew it. You saved more lives in 6 months than most surgeons save in a career. Patel was nodding slowly, like pieces were finally clicking into place. Stephanie's mouth had fallen open. Webb just stared. Maya took a step back, her shoulders tight, her face unreadable. I left that behind. I know, the man said softly, but it doesn't change what you did. It doesn't change who you are. She looked at him, really looked at him, and saw the scar on his neck, the way he favored his left leg, the gratitude and pain written across his face. What's your name? She asked quietly. Sergeant David Moss, Retired. He smiled, tears running down his face. You called me Sergeant Stubborn. Be born because I wouldn't stop talking during the surgery. Maya closed her eyes. She remembered. She remembered all of them. When she opened her eyes again, the room was still staring. Webb's expression had changed entirely, the dismissiveness gone, replaced by something close to awe. You were Army, he said slowly. I was a lot of things, Maya said, her voice steady now, resigned. But I'm a resident now. That's all that matters. That's not all that matters, Patel said from the doorway, his voice quiet but clear. Maya looked at him. He nodded once, a gesture of respect she hadn't earned here, but had earned somewhere else. Moss stepped closer, his voice soft. I didn't come here to expose you, Captain. I came to say thank you. I've been looking for you for 3 years. You found me. Yeah, he smiled. I did. He extended his hand. Maya hesitated, then took it. His grip was firm, grateful, alive. Thank you, he whispered. She nodded. Unable to speak, he left. The room stayed silent. Webb was the first to move. My office, now. Maya followed him without a word, feeling the weight of every eye on her back. Maya sat across from Webb in his office, hands folded in her lap, face carefully neutral. He hadn't said anything yet, just stared at her like he was seeing her for the first time. How much of it is true? He asked finally. All of it. You were a captain. Yes. Army surgeon. Yes. 3 tours. She nodded. Webb leaned back in his chair, processing. And you came here as a second-year resident. Why? Because I wanted to be a doctor again, not a soldier. You're overqualified for this program by about a decade. I know. He rubbed his face, exhaling slowly. Chen, you could be an attending. You could be running a trauma department. I don't want to run anything, she said quietly. I just want to practice medicine. Before Webb could respond, the disaster alarm screamed to life. The sound tore through the building, loud and relentless, the kind of alarm that meant everything was about to go sideways. Webb's phone lit up. He answered, listened, and his face went pale. Bridge collapse on I-5, mass casualty event, inbound, 40+ critical patients. He stood, already moving toward the door. All available personnel to trauma. The department erupted into chaos, residents scrambling, nurses shouting, equipment being wheeled in every direction. People colliding, voices overlapping, nobody coordinating. Webb started barking orders, but his voice was drowned out by the noise, lost in the confusion. Maya stood in the center of it, perfectly still, watching the chaos unfold around her like a slow-motion wave. Then she moved. Bay 1 through 4, penetrating. Penetrating trauma only. Her voice cut through the noise like a blade, sharp and clear. Bay 5 through 7, crush injuries and compartment syndrome. Bay 8, pediatrics, triage nurses, color code incoming by severity. No yellows in the red bays. Move. People hesitated. She wasn't an attending. She wasn't even senior. Now, they moved. Webb stared at her, his mouth half open to object, but the first ambulance was already pulling in, and there was no time to argue. For the next 90 minutes, Maya orchestrated controlled chaos. She moved between bays like a conductor, her hands steady, her voice calm, every decision instant and correct. She prioritized surgeries, reallocated resources, redirected residents who were frozen or overwhelmed. She didn't yell. She didn't need to. At one point, a resident panicked during a chest decompression, hands shaking, needle angled wrong. Maya stepped in, took the needle, placed it perfectly between the ribs, and the patient gasped as pressure released. You're okay, she told the resident. Reset and try the next one. Nodded, hands steadier now. At 2:11 in the afternoon, the sound of rotor blades cut through the noise outside. Heavy, military. Everyone in the trauma bay looked up. A Black Hawk helicopter landed on the hospital's rooftop helipad, rotors still spinning, dust and wind scattering across the landing zone. 2 soldiers in dress uniforms stepped out, followed by a woman in Air Force blues, rank insignia gleaming on her shoulders. Colonel. She walked into the trauma bay with the kind of authority that made people step aside without being asked. Her eyes scanned the room, taking in the organized chaos, the functioning system, the residents moving with purpose. And then her gaze landed on Maya. Captain Chen. Maya turned slowly, her face draining of color. Colonel Reyes. The room went dead silent. Webb stepped forward, his confusion finally turning into something sharper. "Excuse me, this is a sterile environment. You can't just—" Colonel Reyes held up a hand, and Webb stopped mid-sentence. "Dr. Webb, I presume," she said, her voice calm and commanding. "I'm Colonel Sarah Reyes, United States Air Force Medical Command. I'm here for Captain Chen." "She's a resident," Webb said, his voice tight. "She's a decorated combat surgeon with 3 tours and a Silver Star," Reyes replied, her tone leaving no room for argument. She looked at Maya. "And we need her back." The room went colder. Patel stepped forward, his voice careful. "Back where?" Reyes pulled a file from the bag slung across her shoulder and set it on the nearest desk. It landed with a heavy thud. "Captain Maya Chen, Army Medical Corps, 274th. Forward Surgical Team, honorably discharged, 2020, after conducting 17 consecutive trauma surgeries during a 40-hour siege in Mosul." She looked around the room, making eye contact with everyone watching. She saved 43 lives in 36 hours, under fire, without rest. Stephanie's hand went to her mouth. One of the residents whispered something that sounded like disbelief. Webb just stood there, speechless. Reyes turned back to Maya, her voice softening slightly. "We have a situation overseas. Field hospital under siege in Sudan. Humanitarian mission. 23 wounded, 6 of them children. No evac possible." Maya's jaw tightened. "Send someone else. The only surgeon they had was killed 4 hours ago." Rhea's eyes didn't waver. "You're the only one who can do this, Captain. You know that." "I'm out." "I know." Reyes stepped closer, her voice quiet now, meant only for Maya. "But they're not. And they're dying." Silence stretched between them, heavy and absolute. Maya looked down at her hands, steady, always steady. She thought of the 11 she had lost. She thought of Sergeant Moss and his daughter. She thought of the faces she still saw every time she closed her eyes. And she thought of the 23 people overseas who didn't have anyone else. She looked up. "How long do I have?" They gave her an office. Just Maya and Colonel Reyes. The door closed. And the noise of the trauma bay fell away, leaving only the hum of fluorescent lights and the distant sound of a helicopter still idling on the roof. Maya stood by the window, arms crossed, staring out at the city skyline. Reyes sat down, her posture relaxed but her eyes sharp. "I can't," Maya said quietly. "You're the only one who can." "I'm not that person anymore." Reyes leaned forward, elbows on her knees. "Maya, I've seen your file. I know what you did. I know what it cost you." "Then you know why I left." "I do." Reyes paused, choosing her words carefully. "But that doesn't change what's happening right now. There are people dying because there's no one else with your skill set." Maya's hands tightened on her arms. "I lost 11 soldiers, Colonel. You saved 43. I remember the 11. Silence filled the room, thick and heavy. Reyes stood, walked to the window, and stood beside her. "You know what happens if no one goes. Send someone else." Maya said, but there was no conviction in her voice. "There is no one else who can operate under fire. No one else who's done what you've done." Reyes's voice softened. "You know that." Maya closed her eyes, and for a moment, she was back in Mosul. The taste of dust and smoke, the sound of mortars hitting close enough to shake the tent. And the weight of a scalpel in her hand while the world exploded around her. She had worked for 36 hours straight, 17 surgeries, 43 soldiers saved, 11 lost. She knew every name, she knew every face. She knew the exact moment each of them slipped away, despite everything she did. "I came here to disappear," she whispered, "to stop seeing their faces every time I close my eyes. I know. I wanted to save people without wondering if the building I'm in is going to collapse, without checking exits, without scanning every room for threats. I know." Reyes let the silence sit for a moment, then spoke again, her voice gentle but firm. "But they're dying right now, Maya, and you're the only one who can stop it." Maya opened her eyes and looked down at her hands, surgeon's hands, scarred, steady, hands that had held together soldiers who should have died, who lived because she refused to let them go. She thought of Sergeant Moss. She thought of his daughter, Emma, smiling in that photo. She thought of the 23 people in Sudan who didn't have anyone. She thought of the 6 children. How soon? She asked quietly. Wheels up in 6 hours. Maya nodded slowly, the decision settling over her like a weight she had carried before and thought she'd put down for good. I'll need my gear. Reyes pulled a duffel bag from beside the desk and set it on the table. Already here. Maya stared at it. Faded green canvas. Her name stenciled on the side in block letters. The bag she had carried through 3 tours, packed and unpacked 100 times, always ready. She unzipped it slowly. Inside, her old uniform, folded precisely. Combat boots, worn but maintained. Medical kit, fully stocked, and at the bottom, a folded flag. She touched it gently, her fingers tracing the edges. Whose? Reyes asked quietly. Corporal Daniels, Maya said, her voice barely audible. 22 years old, bled out in my hands from a femoral nick I couldn't clamp fast enough. Reyes didn't say anything. Maya closed the bag. I'll do it, but when I come back, I'm done, for real this time. Understood. And I want something in return. Reyes raised an eyebrow. What? This hospital needs to change. Residents get listened to. Competence gets recognized. No one gets dismissed because they don't fit someone's expectations. Reyes smiled faintly. I think Dr. Webb is already reconsidering a few things. Make sure he does. You have my word. Maya picked up the duffel, slung it over her shoulder, and turned toward the door. Reyes stopped her. Maya. She looked back. For what it's worth, Reyes said quietly, you're the best I've ever seen, and I've seen a lot. Maya nodded once. See, then walked out. The trauma bay had quieted. The mass casualty event was winding down, patients stabilized, surgeries underway. The chaos transformed into controlled order. Webb was at the desk, reviewing charts. He looked up when she approached. You're going, he said. It wasn't a question. Yes. He set the chart down, his expression complicated. Respect, confusion, maybe a little guilt. I owe you an apology. You owe me respect, she said quietly. And so does everyone else who assumed I was less because I didn't demand to be more. Webb nodded slowly. You're right. She looked around the room, at the residents who were watching, at Stephanie and Patel and the nurses who had dismissed her. I didn't come here to be a hero, she said, loud enough for everyone to hear. I came here to be a doctor. That's all I wanted. Patel stepped forward. For what it's worth, we're lucky to have you. You were, Maya corrected. I'll be back in 2 weeks. When I return, I expect things to be different. Webb straightened. They will be. She held his gaze for a moment, then nodded. She walked to her locker, pulled out her jacket, and slung the duffel over her shoulder. On her way out, Sergeant Moss was standing in the hallway. He saluted. She stopped, surprised, then returned it. Bring them home, Captain, he said quietly. I will. She walked out into the cold Seattle morning, toward the helicopter waiting on the roof, and didn't look back. 14 days later, Maya walked back into Seattle Grace Hospital at 6:30 in the morning. She looked different, thinner, darker circles under her eyes, hair pulled back tighter than before. But her hands were steady, her steps measured, and her face carried the kind of calm that only came from surviving something that should have broken you. The trauma bay was quieter than usual. The morning shift just starting, residents gathering for rounds. When she stepped through the doors, conversations stopped. Webb was at the nurse's station, reviewing overnight cases. He looked up, and something in his expression shifted. Relief, maybe. Respect, definitely. Dr. Chen, he said, and the title carried weight now. Welcome back. She nodded once. Dr. Webb. Patel appeared from one of the bays, a slight smile on his face. Good to see you. You too. Stephanie approached slowly, hesitant, her usual confidence replaced with something that looked like genuine contrition. Dr. Chen, I need to say something. Maya waited. I was wrong, Stephanie said, her voice quiet but clear. About you, about a lot of things. I judged you before I knew you, and that was unprofessional. I'm sorry. Maya studied her for a moment, then nodded. Apology accepted. Don't let it happen again. It won't. One of the second-year residents, the one who had fumbled the intubation weeks ago, stepped forward. Dr. Chen, I just wanted to say thank you. For what you did during the mass casualty, you kept me from falling apart. You kept yourself together, Maya said. I just reminded you that you could. He nodded, visibly grateful. Webb cleared his throat. Dr. Chen, if you have a moment, I'd like to speak with you. They walked to his office, and this time, the door stayed open. Webb gestured to a chair, but Maya remained standing. The hospital board met while you were gone, he said. Colonel Reyes provided them with a full briefing on your background and your recent mission. Maya's expression didn't change. And they want to offer you an attending position, trauma surgery, effective immediately. She was quiet for a moment. I'm a second-year resident. You're a combat surgeon with more field experience than most attendings will see in a lifetime. Webb leaned forward. You've earned this, Chen, multiple times over. What about the other residents? What about them? They'll resent it. They'll say I didn't follow the proper path. Webb shook his head. Then they'll be wrong. And if they have a problem with it, they can take it up with me. Maya considered this, her hands resting loosely at her sides. I'll accept on one condition, she said finally. Name it. I want to help restructure the residency program. Implement mandatory respect protocols. Anonymous reporting for dismissive treatment. Resident-led case reviews where their input actually matters. Webb smiled faintly. The board already approved it. They're calling it the Chen Protocol. Maya blinked, surprised for the first time in weeks. They want you to lead the implementation, Webb continued. You'll have full support. She nodded slowly. Then I accept. Webb extended his hand. She shook it. Over the next 3 months, Seattle Grace changed. Residents were listened to in a way they hadn't been before. Morning rounds included structured time for junior voices. Attendings were held accountable for dismissive behavior. The culture shifted slowly, but it shifted. Maya led by example. She taught with precision and patience, expecting excellence but never belittling failure. She demonstrated techniques in the OR with the kind of calm authority that made even senior attendings stop and watch. She was tough, but she was fair. And she was respected. One afternoon, Stephanie found her in the supply closet, restocking a crash cart. You don't have to do that anymore, you know, Stephanie said. You're an attending now. Maya glanced up. I know, but someone has to make sure it's done. One right, Stephanie smiled. You haven't changed. Yes, I have, Maya said quietly. I just haven't forgotten where I came from. Stephanie nodded, then hesitated. Can I ask you something? What was it like, over there? Maya set down the IV kit she was holding and met Stephanie's eyes. It was the hardest thing I've ever done, she said. Every day you wake up knowing someone might die, and some days they do, no matter what you do. But some days, you save someone who shouldn't have made it. And those days make the rest of it worth it. Do you regret it? Going back? Maya thought for a moment. No. I regret that it was necessary, but I don't regret going. Stephanie nodded, understanding settling across her face. Later that evening, Maya stood in the trauma bay, watching the new residents run a simulation. They were good, confident but not arrogant, listening to each other, working as a team. Patel appeared beside her. You did this. They did this, Maya corrected. I just gave them permission to be better. That's more than most people get. She didn't respond, just watched the residents work. One of them made a mistake, caught it immediately, corrected course. The others adjusted without judgment. Maya smiled faintly. On her wrist, the paracord bracelet was still there. But next to it now was something new. A hospital ID badge, clipped to her scrub pocket. Dr. Maya Chen, trauma surgery attending. She looked at it for a moment, then turned back to the bay. There was work to do. And for the first time in years, she felt like she was exactly where she was supposed to be. 2 years later, Maya stood in the observation gallery above operating room 3, arms crossed, watching a chief resident perform a complex thoracic procedure. The gallery was full, medical students and junior residents leaning forward, taking notes, whispering questions to each other. Below, the residents' hands moved with confidence, but not arrogance, precision, but not rigidity. She talked her team through each step, listened when the scrub nurse offered a suggestion, adjusted her approach when the anatomy didn't match expectations. Maya nodded approvingly. The door behind her opened, and Patel stepped in, 2 cups of coffee in hand. He handed her one. Dr. Martinez is doing well, he said quietly. She is. You trained her. I gave her the tools. She did the work. They watched in silence as the resident completed the procedure, closed, and stepped back. The attending supervising nodded his approval. In the gallery, the students broke into quiet applause. Patel glanced at Maya. The Chen protocol is being adopted by 4 other hospitals now. Did you hear? I heard. They're calling you a reformer. Maya's mouth twitched into a faint smile. I'm just a trauma surgeon. You're more than that, and you know it. She didn't argue. They left the gallery and walked through the hospital corridors, past residents who nodded respectfully as she passed, past nurses who greeted her by name, past patients who had no idea that the calm woman in scrubs had once performed surgery in a war zone while the building shook from mortar fire. Maya's office was small, tucked into a corner of the surgical wing. The walls were bare except for 2 things: a framed photograph of the 274th Forward Surgical Team, taken in Kandahar. Faces young and tired, smiling despite everything. And a shadow box containing a folded flag, a silver star, and a faded paracord bracelet. She stood in front of it for a moment, like she did every morning, remembering. Her phone buzzed, a text from an unknown number. Captain, it's Sergeant Moss. Emma's starting medical school next fall. Thought you'd want to know. Thank you for everything. Maya stared at the message, something tight in her chest loosening just slightly. She typed back, "Congratulations to her. She'll do great things." She set the phone down and looked at the shadow box again. 11 names were engraved on a small plaque at the bottom. Corporal Daniels, Private First Class Nguyen, Specialist Torres, Sergeant Hammond, and 7 others. She touched the glass gently. "I'm still here," she whispered, "still saving them." A knock on the door pulled her back. Webb stood in the doorway, holding a tablet. "Got a minute?" "Always." He stepped inside, glanced at the shadow box, then back at her. "We have a situation. Incoming trauma, multi-vehicle accident on the highway. Estimated 12 critical patients. It's going to be tight." Maya's expression shifted instantly, the calm settling over her like a cloak. "How long?" 10 minutes. She grabbed her trauma gown from the hook, already moving. "Let's go." They walked together toward the trauma bay, and Maya felt the familiar hum of adrenaline, the mental checklist clicking into place, the world narrowing to what mattered. The trauma bay was already preparing, residents moving with purpose, nurses setting up bays, equipment being staged. Maya stepped into the center of the room, and the noise quieted. "Listen up," she said, her voice calm and clear. 12 incoming. We don't know specifics yet, so stay flexible. Prioritize airway, breathing, circulation. No one panics, no one freezes. You've trained for this. Trust your training. Trust each other. She looked around the room, meeting eyes, grounding them. And if you don't know what to do, ask. There's no shame in asking. There's only shame. Shame in guessing wrong when a life is on the line. Nods all around. The alarm sounded. The doors burst open. Chaos rolled in on gurneys. Voices shouting vitals. Blood pressure dropping. Oxygen saturations critical. And Maya moved. She didn't yell. Didn't rush. Just moved with absolute certainty. Directing traffic. Calling out orders. Her hands steady as she intubated a patient whose airway was collapsing. Then moved to the next bay where a resident was struggling with a chest tube. "Angle it lower," she said calmly. "There. Now advance." The tube slid in, air hissed out, the patient stabilized. For the next 2 hours, Maya orchestrated controlled chaos, and when the last patient was stabilized, the trauma bay fell into exhausted silence. She stripped off her gloves, washed her hands, and looked around at her team. Tired, shaking slightly, but standing. "You did good," she said quietly. "All of you." A resident, young and still wide-eyed, looked at her. "How do you stay so calm?" Maya thought for a moment. "Because panic doesn't save lives," she said. "Competence does, and you're all competent. You just have to trust that." She walked out of the bay, and Patel was waiting in the hallway. 12 for 12, he said. "Not bad." "Not bad," she agreed. They stood in silence for a moment, the fluorescent lights humming above them. "Do you ever think about going back?" Patel asked. "To the field?" Maya looked at him, then back toward the trauma bay, where residents were cleaning up, talking quietly, learning from what they'd just lived through. "I am in the field," she said. "It just looks different now." Patel smiled. "Fair enough." Maya walked back to her office, sat down at her desk, and pulled out a notebook. She wrote down the names of the 12 patients they'd saved. She always wrote them down. 43 in Mosul, 12 today, hundreds more in between. She closed the notebook, looked at the shadow box on the wall, and allowed herself a moment of quiet. The faces of the 11 she'd lost stared back from memory. But so did the faces of everyone she'd saved. And for the first time in a long time, the balance felt bearable. Her phone buzzed again. A message from Colonel Reyes. "Proud of you, Captain. You're exactly where you're supposed to be." Maya smiled faintly, set the phone down, and stood. There was work to do. There was always work to do. And she was ready. She walked back into the trauma bay, where a new case was just rolling in, and her team looked to her with steady eyes. She nodded. They moved, and Maya Chen, soldier and surgeon, teacher and healer, stepped forward into the work she was born to do. Not because she had to, but because she chose to. Every single day.